Good afternoon, good evening, everybody. We are so glad that you can join us. Welcome to the Illinois Legislative Black Caucus Foundation's webinar. I am so pleased to have this opportunity to introduce the joint chairwoman of the Illinois Legislative Black Caucus, Chairwoman Carol Ammons.
Thank you, Executive Director Tiffany Hightower, and thank you to all of you who've decided to take a few minutes with us this evening to talk about something that's really, really important and help us to spread the information out to our communities. The Medicaid redetermination that you are going to learn about today, it's extremely important that people know what to do. Over the last several years and since the pandemic, we saw an increase in the need for Medicaid for our community. The COVID really changed the game. And so we know that we have a lot of people who really depended on Medicaid and SNAP benefits. And now we're leading into the redetermination time. We estimated across the country that 14 million people could lose coverage if they are not aware that their redetermination is extremely important and they need to respond immediately. And so we decided that we would partner with our foundation, with our executive director and our foundation board to bring to you this very important training and webinar that I do hope is beneficial for either you or someone that you know. We need you to help us as a partner to spread the information to community groups, to outreach groups, to young people, to older people, to help translate for those who may not even speak English or English is a challenge for them. And so we want to maximize the opportunity to bring to you our partners at the state level who will talk through this entire process for you and answer your questions at the end of this webinar. So please, you will get instructions on how you can ask your questions during this webinar, but we at the Illinois Legislative Black Caucus, we are overwhelmed with the number of calls and questions that come to our offices about the Medicaid and SNAP redetermination. And that's why we've made this a priority this evening. And so I do hope it is useful for you as a participant. And we will do our best to get you the right answers because we've brought the experts with us. And so because of that, I am going to turn this right back over to our executive director to get us right into the midst of our program this evening so that you can get your questions answered before we leave. And thank you, Tiffany, and to our foundation for being such an amazing partner for us as the policymakers of the ILBC. So with that, thank you all so much.
Thank you so much, Joint Chairwoman Ammons. We really appreciate the partnership that we have with the caucus and the intimate work that we do to ensure that the lives of Black Illinoisans are forever changed and forever impacted with a positive trajectory. So thank you once again for being that thought partner and being that leader from that space. We love the ILBC. So I want to, at this point, thank and welcome our partners who have joined us, as Joint Chairwoman Ammons so eloquently put, the people who have the answers, because we don't. We want to first welcome HFS, IAMHP, and they're going to tell you what these acronyms mean. I think I'm going to say this right. Is it DFS, or did I say that right? Did I get it correct, Tim? Or did I say it wrong?
DHS.
DHS, so I said it wrong, and that's why we have experts that know when I'm wrong, and I can be okay with being wrong. And then we have the Office of Budget and Management, who oversees GATA. And we're bringing GATA on as well because we understand also that a lot of the non-for-profits and the community-based organizations that do this work and that also spread the word in their communities need to build capacity so they can do it better. And the way to do that is to partner with the state. And the way that you can partner with the state is you've got to be GATA certified before you can access some of those grant monies. So we want to make sure that everybody is on the same page and receiving this great information. And with that, no further ado, moving fastly through this, I am going to hand this over to Sergio and Angela from HFS. The government of acronyms. I love it.
Fantastic. Thank you so much for the introduction there. My name is Sergio Obregon. and I am with the Illinois Department of Health Care Family Services, and I serve as a special assistant to the director of the agency. I am accompanied today with my colleague, Angela Ryan, who serves as the Director of Legislative Affairs. And we are here to talk today about the end of the continuous coverage requirement and the process that we're going through in terms of restarting redeterminations. I want to start really quick with what our vision is at HFS. Our vision is we improve lives. We know that working together in partnership with agencies that were just mentioned, such as DHS, IMHIP, and GATA as well, right? We can improve lives together, and those are your lives. And you can also help with this endeavor by embarking on some of the things that we're going to go through in just a few moments. Let's start with our goals. The goals at HFS, our goals at HFS, which I believe we have in common, are to minimize the number of eligible customers who lose coverage. And this is with respect to the restarting of redetermination. We are here to provide all customers with access to multiple customer-centered redetermination, completion, and submission opportunities, AKA submitting your renewal forms. We want to make sure that all Medicaid eligible customers continue to connect with healthcare providers. Top goal. Let's start with a little bit of a background. If you haven't heard by now, the public health emergency will be ending on May 11th. Within the public health emergency, there was a piece of that emergency that related to Medicaid and the continuous coverage that people were going to be getting as a result of enacting the public health emergency. President Biden, back in December, signed into law the Consolidated Appropriations Act that said the public health emergency will continue until May 11th, but we need to start redetermination sooner than that. And as a result, it decoupled. It took away the continuous coverage requirements from the public health emergency. And now we had a firm date of when we were going to start redetermination, which is March 31st. That date passed. Our state's Medicaid operations process was going to start on April 1 to get everything ready, which now meant that by May 1st, all redeterminations for cases that needed to renew in June would be sent. And we now knew that if if in the middle of June we did not receive that paperwork, then cases would start closing and people would lose coverage effective July 1. So here I have a timeline that talks a little bit about what those key dates are. End of certification period, if you can see all the way to the left hand of your screen, that is the end date of which when medical eligibility will end for particular customers. Not everybody will be going through the redetermination process at once. I need to make very clear, as you see there on the bottom, but forms will be sent out. And in this case, these are forms for customers whose certification will end on June 30th. They're the first customers to go through this process. Forms will be sent out, as I mentioned, by May 1st. Following along on the chart, there will be a READY due date printed on those notices for June 1. And there is a cutoff date for when we need that information, and that is the middle of the month. And as you can see, I have listed here the first 3 months of when we start redetermination. You see June, July, and August. You will be receiving these at the end of this presentation for your reference to continue to learn a little bit more on your own about this process. I'd like to bring to the front of the line a form that a Medicaid customer could potentially receive. And this is what's called the ex parte form. I want to draw your attention to the red square, medical benefits redetermination notice. If you read that, it will say, based on the information we have today, the person listed below will continue to receive medical benefits after, this is a little dated, but this will say after June 30th, 2023. And it lists the individual there or individuals in the household that will continue Medicaid coverage. Very important notice here, because these are the ones that you will start seeing in your mail if we have your correct mailing address. This sample Form B is one that customers will also be receiving. This notice is basically saying it is time to renew, as you can see indicated in the red box. It is letting you know that it is time to renew your medical benefits. And more importantly, that third line in that red box, you must complete your redetermination to continue medical benefits after April 2023. You must complete. Keywords there. You must take action. I'd like to point this slide out here in terms of the percentages for the month of June of customers who will be receiving the ex parte notice versus the Form B. We ran the numbers for the month of June, and we found that 51% of our Medicaid customers will receive a form that does not require action for them to take on it unless there's a change, as you can see listed here. Historically, we hovered between 30 to 40%, but in this case, we have gone up to 51% through enhancements that we've made, continuing to advocate to facilitate a process that is, again, working for both the customer and our caseworkers. Looking down to Form B, there's going to be 49% of our customers who will be receiving a Form B. And I like to call that out, that this does require a customer action. Think of yourself as a customer if you're on the Medicaid program, or think of those neighbors you may have. Do they have earned income that they're through self-employment? Do they work on their own account? These are reasons that you can see listed here of why somebody might receive a Form B. For example, as I mentioned, a case record has self-employment. Bullet number 1, earned income exists on the case, but we didn't find any in our electronic clearances. Again, we need to look into that and see, are you still eligible? Moving along, I'd like to point out the 4 ways that we have to complete redetermination. The first here, the first box on your upper left, online through abe.illinois.gov, through Manage My Case. Over to the right, by phone, DHS, our partner, who you will hear from in just a moment, has created a sophisticated system to where if the caller calls that call center and it's time for them to renew, it's so dynamic that they will be triaged over to a caseworker to help them renew. If it's not time for them to renew, well, they will be triaged over to HFS so they can learn about the renewal date. Also, the customer has the option there to your lower left to mail the notice or fax it, or they can return it, the form in person, to one of the DHS Family Community Resource Centers. How to find your renewal date? Well, you can go through Manage My Case, which I will explain in just a moment. If you have an MCO, which we have Illinois Association for Medicaid Health Plans on the call today as well, if you're enrolled in an MCO, they have this data. We are partnering with them. The message is amplified. Everybody must renew. Where you do it? Well, the options are there for you. Here is a quick screenshot of Manage My Case. And again, we encourage, this is our gold standard, and we encourage people to go and create an account or log into an existing account and take control of your case online. You will get notices. You will see your renewal form before you get it in the mail, perhaps, and you can take that action expeditiously so you can make sure that you, your family, your loved ones continue the care that they need. The 3 C's of Manage My Case: create, check, and change. I showed you just a screenshot just a bit ago about creating your account, but with Manage My Case, again, as I mentioned, you can check your renewal date. You can review your case information. You can check for notices. And also you can change your address. You can change the income that's coming in. You can submit your renewal form, one of the most important features of this presentation today. I'd like to just one last moment, take a moment to highlight the Ready to Renew toolkit that we have that is located on our Illinois Medicaid Renewals Information Center. Here you will find a toolkit. You will also find training that we've been providing to providers, stakeholders, agency-wide through HFS to ensure everybody has that uniform message of, let's get ready to renew. You will find frequently asked questions. If you have a question, Go there first and see if we're answering it. If not, we're always available to help you understand the importance of renewing your benefits. Social media, again, let's get the word out there. Here is a slide that links you to Twitter, Facebook, and LinkedIn. Help us spread the word. It's our job collectively to make sure that we build a better community by ensuring everybody has access to this information. And with that, I want to thank everybody. The 10 minutes flew by very quickly. A lot of information. This information will be presented to you in the form of a recording, I believe, and also the slides will be sent to you that I will be sending the group here. But again, Medicaid.illinois.gov, everything you need to know about the Illinois Medicaid redetermination process, and it's located on that link there, highlighted in purple on our information center. I'm going to transition this now over to Samantha Oldfry from the Illinois Association for Medicaid Health Plans, who has been doing a great job with the health plans in helping us leverage them to get the word out. And Samantha's going to be sharing some words with you as well around the work they're doing, and also the toolkit that's a more synthesized version of what we have that can also be used to spread the word. Thank you very much. Samantha, I turn it over to you.
Thank you so much, Sergio, and thank you, Tiffany Hightower and the Illinois Black Caucus Foundation for having us, along with, of course, Joint Chairwoman Ammons. We're very excited to walk through the IMHIP toolkit that you will see here. And what this really is meant to do is to share information with community-based organizations, providers, legislators in district offices. It really synthesizes everything that Sergio went through, and we'll start scrolling through right now. So of course you have our table of contents, all hyperlinked. So if you just want to get to the action steps or the overview or just the forms themselves, you can hyperlink as you're reviewing this. And then of course, we have links to HFS's website in order to get to all of that information Sergio was just talking about. We'll continue to go through. We have the overview. We have an example timeline. So Friday, I believe tomorrow, our letters are being sent and they will be received by May 1st. And then that paperwork is due June 1st, and loss of coverage, as Sergio walked through, would begin July 1st. There's a 90-day reinstatement period for this first cohort. But remember, this is occurring every 12 months or every month over the next 12 months, and that those members it is not a cliff. I think that's really important to underscore. And so this is just the first timeline, the first cohort, but it moves forward throughout the next 12 months. We'll continue. So the action steps to renew, we really wanted to just simplify this because it's so complex and there's so much going on. And so really the first and foremost, most important thing, update your address. HFS, in order for you to receive this letter, that you need to HFS needs to know where to send it. So update your address. Second, know your redetermination date and put it in your calendar. Again, some members are going to receive this letter on Monday. However, some are going to receive it, come July or February of next year. And so find out your redetermination date now and put it in your calendar. You can do that through ABE. You can do it through calling your MCO. You can do it through talking to your provider as well, your doctor. And then third, when it is your time to renew, fill out your paperwork and submit it. And again, online through Manage My Case is the gold standard. We also have, of course, over the phone or completed, and you can drop it off or you can fax it or mail it in. On this, we also want to highlight, of course, what the envelope looks like. This is what members are going to be receiving right here. And so we have that right there. All right. So the Medicaid forms, there are two types of forms, and we have the samples in the toolkit. And so we have this wonderful updated information. But Form A, I like to keep things simple. Form A is ex parte. It rhymes. It means that we know that you don't need to do anything. And so that is our next form. And of course, we have this information, but for the June cohort, 51% of our members are ex parte. And so we'll scroll and look at that Form A sample. You can see here, and we highlight, this is the Medicaid benefit redetermination notice. And you can see the dates. All right, and then Form B, and this is the group we really want to focus on because these are the people that need to send in paperwork. And so we'll go to what that looks like. And this is the updated letter. So first and foremost, we have here the date that it needs to be sent in. And we highlight that very clearly. We'll go to the next page. All right. So you must respond no later than June 1st in this example, and then you will lose coverage July 1st. We really want to understand that those dates are close, but June 1st is the deadline. All right, we want to make sure here, if you see on question 3, you need to verify both your mailing and your physical address. On question 4, we highlight here that you need to submit 30 days or a full month of pay stubs. And so that depends on how often you're paid. So if you're paid weekly, you need to submit 4. If you're paid monthly, you need to submit 1. We will highlight that you need to remember to sign the form. All right, there we go. And we, of course, we've already gone through Manage My Case, but we have a really nice tool here just to sort of see what it looks like, see everything that Sergio already walked through. And then our ability to assist. So first and foremost, we are sharing updated information with the with HFS that we've received. We are reaching out to Medicaid members. We're reaching out to providers as well, really partnering. If you need information around the members that you're serving, patients you're serving, connect with your MCO partners and figure out what those partnership opportunities look like. And then, of course, do call us if you are a member and you have questions about what's your redetermination date or very straightforward questions or need help setting up a Manage My Case account. Your MCOs are here to help. And these are the numbers depending on which MCO you're enrolled in. And we'll go on. We also have best practices for how healthcare providers can assist their patients on redeterminations. And what really I want to highlight as we scroll down a little bit is first how to access EDI information for a query from Medi on what those redetermination dates are. But we also have a screenshot of where you're going to see that information. And so we have this here. And you can sort of see where the date is, where the form is. Again, you're going to find that form information to be most accurate 30 days or so before their redetermination date. And so for this example, you can see very clearly this is Form A, which rhymes with ex parte, which means that they won't need to submit their paperwork. We'll go on. And then we have information on how to obtain coverage for those who are no longer eligible on the marketplace. While we are really focused on making sure people don't lose coverage because of paperwork, we recognize there are also going to be people who just need to transition coverage. And so we have information here, and the plans will be assisting with that as well. And this is the sample notice of what a member would receive if they're no longer eligible. So we just have that in here. And then we link all of those helpful resources, the things that Sergio highlighted, all of the plans, current FAQs, and we'll continue to update this as we get more information so that you all have the information that you need in a nice, simple format rather than trying to remember all of those links, which can be hard. I lose them all the time. We'll go to the next one.
That is the end of the toolkit with those helpful resources there at the end for you all.
Perfect. Thank you all. And with that, we'll hand it on over to DHS. Thank you so much.
Thank you. And thank you everyone for being here. My name is Tim Very. I'm the director of the Division of Family and Community Services, which falls under DHS, Department of Human Services. I have with me today our SNAP policy expert that will be explaining some items about the PhD ending and with regards to your SNAP benefits. But I did want to thank Sergio for a well put together presentation. We partner with HFS as our staff across the state process the eligibility. And so we will be able to, if you have any issues with ABE, you can go to our local offices across the state. And in the past, those of you who have tried to call a local office know the problems we've had. We have fixed all that with a brand new call center, the number he has on his slide presentation, and the IVR waits. It's the new IVR system that, as Sergio said, is very smart. It will move you quickly, and you will not have to spend hours on a phone call like we've had to do in the past. Our average wait time is 8 minutes right now. So with that, I would like to turn it over to Terry Van Eyder to walk through what has happened with the emergency allotments ending with your SNAP benefits. Thank you. Terry?
Thank you, Tim. Yes, Tim is my boss. I do work for the Bureau of Policy Development, and we work with SNAP, but also we work with cash assistant programs. So we do work very closely with USDA Food Nutrition Services. One thing I wanted to add to the call center is that we are extending our call center timeframes. So usually they're from 8 to 5 or 8:30 to 5, excuse me. They will be 8 to 6:30. So that should help out with the customers calling in. And I don't know if Sergio mentioned it, but they can do their medical redeterminations. He did mention it, medical redeterminations over the phone, which should be very helpful to our customer clientele. So I don't have a wonderful slideshow that the two previous individuals did. I only have some dot points, but I can forward the dot points so they can be included in the notes or the slideshow if they're going to do one. What I basically want to talk about tonight is just the emergency allotments that actually began March of 20, and we did end those benefits February of 2023. What they were, any active SNAP case, they are allotted a certain SNAP amount, but that is according to their income. So whatever income they have coming into their home does budget out to determine what they're actually eligible for. So the emergency allotments, what they did was supplement the difference from what they were eligible for up to the maximum that that household was eligible for. So we did those in two separate allotments so they did not get them confused anytime during the PHE. So they would get one regular allotment, and then the third week of the month, they were receiving their emergency allotments. We averaged about 1 million SNAP cases during this entire PHE. And some data surrounding the emergency allotments, we had our largest emergency allotment issued at $2,270. So $2,270 was the largest emergency allotment issued. The average emergency allotment for a household was $172. The average per person, $108. And the minimum amount that any household actually received during this entire period was $95. When we knew that the benefits were going to come to an end, we worked with DHS Communications, who also had a marketing company, a marketing firm that worked well with us. And then we certainly worked with all the advocates. Wanted to make sure that February, the last month of the allotments, was known to all the customers. The first part of January, we mailed out over 1 million client notices. And the notice explained a lot. We thought it did. Advising them when it was going to end. We told them how they could maximize what their regular SNAP allotments were. So, if there was any deductions that they were not reporting, they needed to contact us because it could very well make an increase in their monthly allotment. We also added several resources to the client notice. We had food pantries, we had homeless shelters, we had WIC services. Those are the three that come to mind. There were a few others. Again, we worked with the advocates, communications. So we had social media platforms. I know we had Facebook. We had our communications put out some clips on the news channels. So we're hoping that we reached our customers in advance to make sure that they were prepared when this benefit did end. And we continually advise the advocates and the SNAP outreach partners, as you come in contact with your customers, make sure they know that emergency allotments are only a temporary benefit during the PHE, and that at some point they will end. A few other things I just wanted, outside of emergency allotments, some projects that we have been working on, maybe you have heard of them. It's the Elderly Disabled Simplified Redetermination Project. Of course, with our acronyms, we are EDSRP. So what this does is for elderly and disabled individuals, they have a 24-month certification period, so a 24-month approval period versus your average 12-month. And then when their redetermination comes due, then they can waive that interview, because most of these households have very stable income, Social Security, SSI, and we can verify that online. So most of our verifications are electronically verified. So we rarely would need an interview, but if the household, of course, wants an interview, we'll certainly accommodate them. Well, that's one thing we're working on. Also, the restaurant meals program, it has started out slow, but we're hoping within the next 12 months to really, get it going. Right now, there's 8 restaurants in Cook County, and am I over my time yet? Almost. And there's 2 in Franklin County, and these restaurants will accept certain individuals who have a link card, and it's identified as such that they can go into a restaurant and actually scan their card for a free meal, so a hot meal. And this is also for your elderly, your disabled, and then your homeless households. So expect that to be expanded within the next year. And then we are actively working with FNS to get our PEBT state plans approved for our current school year, as well as the childcare. So those should be approved very soon. And then one other thing I wanted to mention was the SNAP replacement. You may have heard of EBT theft claims. We are working with FNS at this time to just finalize a plan. So I can't really talk a lot about when implementation will come, but just know that we're working towards getting that plan approved very quickly with FNS. I think the only other thing I wanted to mention was, although HFS has waived the medical redeterminations throughout the PHE, we only waived SNAP-REDs I want to say a year, because I believe it was April 2021, we started up our redetermination process. So we've been working our SNAP cases ever since. And I think that's all. And I am going to turn it over to Lori and Jennifer with GATA.
Thank you very much. We are a little bit different element of the agenda for today, but nonetheless, looking forward to sharing with you a little more in regard to the certification process that organizations go through to become providers of grant programming and services. So we are very grateful to the Illinois Legislative Black Caucus Foundation for extending the invitation today. Most thankful to Joint Chairwoman Ammons for allowing us the opportunity to kind of focus on the side of the house of doing what we're required to do to stand up recipients for the programs and services that are provided through grants, and also to put in place some names and contact information to make it easier for those of you who are pursuing grants to kind of introduce you to the relationships and the personnel that are involved in this process. So I am very appreciative of being joined this evening by Lori Beeler, the Director of the Grant Accountability and Transparency Unit. And without further ado, we'll jump right into this presentation. A little context on the front end. Illinois relies heavily on grants for program and service delivery. We're in a unique situation in Illinois because we do rely extensively on our community recipients to carry out the programs and services that are expected. We distribute approximately $15.8 billion in state issued awards between state agencies and the grantees who are carrying out those programs and services. Grants in Illinois take on a lot of different facets. They help build and repair our roads and our infrastructure. We work extensively with community-based organizations, not-for-profits, and others to carry out programs on behalf of the state. We do not have a structure in our state government to do the majority of the programs and services that are needed, that are typical of state funding initiatives. But we rely on those critical relationships with our grantees to deliver the services. Many of the focuses on the redetermination are looking specifically at some of those more vulnerable citizens, individuals who are really benefiting from the specific programs and services that DHS, HFS, DCFS, and other strong community advocating state agencies work with through their grantee communities. Grants are also a key component of delivering training and reassessing and redirecting skill development. I know a lot of people think about the programs and services that grants are delivering, but I think that training element is so critical today, given some of the economic challenges that many in our communities face. Just to put a little bit of quantification behind grants, this last bullet on this slide emphasizes that we currently operate more than 2,500 programs through grants. We have nearly 47,000 awards or grants that we run as a state. And Illinois does business through more than 9,000 grantees. So I hope you can take away from this really the emphasis that grants are a significant element of Illinois' service delivery programming, and that the grants and the certification for grants are critical to the success for our community served. So this slide gives a bit of context for how GATA was established and what the baseline for this was. Early on, the Human Services grantees expressed frustration because there were a number of different requirements for grants. Sometimes it was a matter of who you talk to or what the agency or the division with the agency put into place. But there were a lot of inconsistencies, and there were some times where the redundancies became very burdensome to those grantees who really had the passion for delivering the programs and services to those communities most in need. We also experienced some oversight issues. There were problems that bubble up, negative, regarding the use of public funds. And that drove the legislative push to establish the GATA legislation. GATA became law under Governor Quinn in 2014. Coincidentally, the federal uniform guidance, or the rules that determine how grants must be administered, also went into effect in 2014. So for many, that leads to the perception that when GATA came along, GATA established the rules for how grants would be administered and the certification regarding grants. But in essence, what we need to better align with is the fact that the federal requirements at 2 CFR 200 establish those requirements, and through Illinois, because of the impetus and the focus of those human services grantees, GATA frameworks were established to enable us to be consistent with our rules, to be consistent with the centralization so that we could eliminate duplications and redundancies. So I'm going to jump over to Lori, who's going to talk a little more about getting GATA certified.
Hi, good evening, everyone. Thank you. As the rest have expressed, very happy to be here this evening. So as Jennifer was talking about, with the impact, the significant number of grants and programs in the state of Illinois, the number of grantees. There are 90, as Jennifer pointed out, there's 9,100, but we have over 14,000 grantees actually registered in the grantee portal that work towards attempt to receive grant funding. So GATA, the frameworks is providing a uniform process and frameworks templates for the registration, pre-award processes, post-award processes. So one of the first things that a grantee needs to do to get started is registering and getting certified through the grantee portal. And remembering, and I heard it in a couple of the other speakers talking about certification status, the dates, the status can change. So you want to make sure you stay on top of the dates of your various registration pieces, and we will go through those. Next slide, Jennifer. All right, this is just a little visual here for that, the grantee registration process. So we have the grantee portal. Many of you may be familiar with that at grants.illinois.gov/portal. And I see we have a typo there. Didn't catch that. Platforms has changed on the website, so now we no longer have a www in front of that. So the grantees start out by registering for a username and a password, a public illinois.gov account. There are help steps in the system. We'll see some screenshots in just a minute. This will allow the grantees to establish a username and a password unique to them to then enter into the grantee portal. So it's an online registration form, and we require very minimal information. An organization needs to know what their tax ID number is, EIN, FEIN, and their UEI. So this is the unique entity identifier provided by the federal government through the SAM.gov system. Formerly, it was the DUNS number, but they've transitioned. So then some organizations are required by the state, by the Secretary of State, to be registered in their business portals. And so you need to have your Secretary of State file ID in order to enter that, so that we can verify that the organization is established to do business with the state of Illinois. So then we ask for your name, the organization's name, the address, telephone number, very minimal information such as that, in order to complete that registration for your organization. So like I said, there's only like 5 pieces of information that is necessary in order to establish that registration. Then through the portal, we have automation set up to where we verify against SAM.gov, making sure that that UEI has been fully registered in SAM.gov. This allows us to look at the organization, ensure that their business address is what they say it is, making sure that they are not on the federal excluded parties list, and that they are able to do business with the state of Illinois. So we also connect directly to the Secretary of State as well for an automated verification. Then in the portal, you will see whether your qualification status. And we have flags next to each item to identify if there is an issue, and also provide remediation information to assist the grantee to be able to fix any issues that may be flagged. Then the next step is for the grantee to complete the internal control questionnaire. This is not required for pre-qualification status. However, it is a step that is a requirement for the application for you, in order for you to submit an application and be considered for a grant award. All right, next slide. All right, so this is what the portal looks like. So as you can see, we need the organizations. Well, we need to update this slide too. So this is the organization. It says DUNS numbers. That is UEI now. The organization's FEIN number, the type of organization. Are you a corporation, a for-profit corporation, a nonprofit corporation, LLC, etc.? So, and there is a drop down here for you to select your organization type. Then we need your Illinois Secretary of State file ID, your organization's name, your address, and a primary email contact and a phone number. Then we do ask 2 questions asking if you have at least 2 years of grant experience. And then we also ask what your fiscal year end date is. So registration is that simple. Yes, the SAM.gov does take some time, so that UEI, receiving a UEI and establishing that registration is a several-day process. We can provide guidance, we can provide information. Unfortunately, that system is outside of our control, and we are actually currently in talks with the GSA, the General Services Administration, on some of the issues that we are hearing that actually everyone across the nation issues they're experiencing with that SAM.gov process. So hopefully we will see some good improvements there from that federal aspect. The right side of the screen shows what that registration status looks like, then that qualification status. So as you can see, we have each item that we're verifying. Then we have a status column, whether it's good or whether there's an issue. And then those help buttons provide specific remediation for that issue. So hopefully this will allow grantees to be able to see what the issue is and remediate. Obviously, we have a help desk, and we are happy, as are the state agencies, to provide any support along the way that is necessary with that. Next slide, Jennifer. And then this just kind of walks through the application and award process. So we have notices of fundings that are posted out on our public website, grants.illinois.gov. Once that NOFO is out there, grantees submit applications. Agencies then must perform merit review of that proposal. If it is a competitive award, then there's scoring. The criteria is identified in the notice of funding opportunity. And so you want to make sure your application addresses all of the criteria that is being required by the agency. Then Once the merit review process is done, then there goes into the awarding process. So if you notice in green here, organizations must be certified to receive a grant. So that is where you want to make sure you are watching your expiration dates of your SAM.gov. When are you required to file with the Secretary of State? So you want to make sure that you maintain those registrations so that that status can remain in a qualified status. And as you can see with funding, this is once you've got the grant agreement, you're performing services, requesting payments. Again, you must remain qualified in order to receive those grant payments. So it is important to look for those dates. Next slide, Jennifer. All right, certification assistance. So while the states, we can't change those federal rules, we can improve how we comply with those requirements. So that is part we want to hear from everyone, from grantees, from state agencies. We like the feedback to make improvements as needed, as required. So next slide. So here's just some information. So here we do have a grantee portal user guide, and this link is to that user guide. It walks you through step by step the registration process, from creating that username and password all the way through the requirements, talking about completing the internal control questionnaire. We also have on our website, we've implemented an email subscription service. We've named it the Illinois NOFO notifications, and every Friday we send out a listing to the subscribers of all of the NOFOs that were published in the previous week. Currently, we have over 1,000 subscribers. Last I heard, I think we were up like 1,100. So it's growing. People are finding it, and this is the link to subscribe. And then on the next page, you'll see this is actually the CSFA on our public website. And you can see here at the bottom, here is the link itself. So this is where you would go in to find the NOFOs. We are also implementing a learning management system, so more to come on that. So to provide training for everyone. All right, next slide. All right, I will turn this back over to Jennifer for her to finish us out here.
So I hope you can see from the material that's been presented, we do have a requirement to ensure that the state of Illinois knows who it's doing business with. That's, a good government requirement, but it's also a federal requirement. So in order to carry out that certification, we are using this GATA system and the Illinois frameworks that Lori explained to help make that happen. We do recognize, though, that it is critical that we are connecting with and relating to various groups. We know that the grantee community does not all look the same. We have different facets of the niches that we are serving, and we have different ways in which we can connect with those community-based resources. It's critical that the grant funds are reaching those diverse groups as well. And from the Governor's Office of Management and Budget and our Grant Accountability and Transparency Unit, we're very committed to ensuring that grant funds are available to the vast groups that are in a best position to provide the services and programming that Illinois citizens deserve. We do recognize that there's a learning curve to completing some of the requirements that the feds and the state have in place. We know that it's not just a matter of submitting an application, but if it's a competitive award, It's a matter of submitting an application that is chosen to receive funding. Once you have that funding, there are also requirements on the post-award side. There are reporting requirements. There is accountability in the use of funds. All of those elements may be new to some of our grantees or those interested in becoming grantees. So we truly value listening sessions like this so that we're able to share some of the details of that certification process and get your feedback so that we know what's working for you, where you have challenges or hiccups, what we can change within those GATA systems or the Illinois frameworks to make it easier to do what is required to certify those that we do business with and to maintain their qualified certification so that you can continue to do the programs and services that our grantees have such a passion for and the community expects and deserves. So our goal in I guess closing is just to emphasize that, you know, we want to make grant administration support and grant funds accessible to as many entities in the state as possible. We are very committed to working with you, to partner with you, to be a support to your needs so that you can complete the certification process that's required so that you can do the great things with the public financial assistance that's available. So it's a kind of a comical way to phrase it. If you got a question, we've got an answer. So we definitely are available. Should there be any follow-up afterwards, this deck will be shared with you. So we are providing those email addresses if there is any specific follow-up. Now that you have those points of reference, a deeper dive into your situation, your needs, or support that we can provide on a direct level, we're very open. So with that said, I'm going to stop sharing and turn things back over to Director Hightower.
Thank you so much for that. Listen, this was a wealth of information. I'm going to kick it to James real quick, the Director of Policy, so he can do the Q&A portion. And then we'll roll it back to Joint Chairwoman Ammons. And because I spy some more ILBC members in the audience, and I'm going to let Joint Chairwoman Ammons bring them forward if they would like. So, James.
Yeah, so good evening, everyone. There was one outstanding question from an anonymous attendee. The question being, would that certify us to perhaps work with schools and churches in our area and make them aware? I don't think we could help with their applications or not. That was answered. Or was
I believe I answered the first part of the question with regards to our community health workers involved in assisting customers, patients, members, families, whatever we call them, whatever we call our customers. And community health workers are involved in a lot of the materials that we've been providing to the public. I did drop a link in my response when I answered our community health workers involved, and I linked it to our medicaid.illinois.gov redetermination information center, because on that information center, you will find on the left-hand column several links that take you to frequently asked questions, other materials, our Ready to Renew toolkit, for example. And also the first link that you'll see is a link to a 3-part webinar series that we kicked off just last week. And today there was another one today. Both of those are recorded. The first is posted from last week. There is another that will be posted, I believe, by the end of the week this week. And we will be having another one actually on May 3rd at 10 o'clock that will go over the forms that a customer would potentially be receiving. and we will be going through those in depth. Now, as we got with respect to certification, if those will certify you as a community health worker, they will not. But I will drop, when I send the email with the presentation and other helpful links, I will also send a link to our our HFS application agent website, which can also be found on our website, which goes through how you can become an official HFS application agent. That process through a business associates agreement with us and your agency can begin the certification process to where you can assist customers with their applications, you can assist customers with managing my case, and you can assist customers with their redetermination. So I'll have that information as well. So there is a way. Let's talk about that, and I'll send that out to you guys.
Sergio, I already, for your ease, put that link for becoming an HFS application agent in the chat, answered the question, so you have that. And I must say, HFS does a great job of just really answering that in a really simple fashion. And so that information is all there.
Oh, thank you so much, Samantha. I appreciate that.
Thank you for that answer. There's one more that just popped into the Q&A. Who are the MCOs partnering with the Complete REDE?
To complete the redetermination paperwork, and I'll go ahead and answer that. So first and foremost, we are going to outreach directly to all of our members, but that's not where we're stopping. So we are partnering with all of the providers that we work with, mostly focused on their primary care physicians, FQHCs, nursing homes, and behavioral health providers, although also outreach, of course, to hospitals as well. Beyond that, we're partnering with housing and homeless shelters. We're partnering with food banks. We're partnering with various community-based organizations, vendors to help as well. So we are really trying to think of every organization that is sort of on the ground with our Medicaid members. And so it's a broad group. I hope that's a helpful answer.
So that looks like those were the remainder of our questions. So I will pass it to Joint Chairwoman Ammons to move forward.
No, James, please read the questions that have been answered in case people haven't gone into there. So please read that and read the answers. Thank you.
All right. So the first question is, which organizations are helping consumers complete their redetermination? This was answered by Sergio. There are many organizations that help, that include healthcare providers. If you reside in Chicago, the Chicago Public Schools helps with this as well. The number for that is 773-553-KIDS or 5437. You can also please visit the medicaid.illinois.gov website and learn more there. The next question is, how soon will we get the recording? Second question is, what is the links to the toolkit? And then the third question is, if someone misses all of the deadlines, when or can they register again? So can they register again? If they are in the system with a number, do they keep the number or would they be assigned a new number, and how would services they receive transfer over? This was answered by Samantha. She added the link to the toolkit.
And
Sergio, if you want to answer the third.
Yeah, for sure. So I can just elaborate just a little bit more on that, James, please. So if somebody misses their deadline, so let's use somebody whose eligibility for Medicaid ends on June 30th. They will be receiving a renewal form roughly by May 1st or within that first week of May. They will have until June 1st to submit it. But we know that life happens, right? And we know that things happen where sometimes we can't make that June 1st date. So then there is a little bit of a grace period, and they will have until the middle of the month, June 15th, to submit that. If we do not receive that renewal form by June 15th, come June 16th, our integrated eligibility system, our technology will advance that case into the cancellation mode. And that customer will receive a cancellation notice stating their coverage will end on June 30th. So on July 1, they will not have coverage. Now, if they miss that June 1st and that June 15th and they no longer have coverage effective July 1, there's a 90-day reinstatement period. Within those 90 days, we ask that please submit the redetermination, not a new application. We don't want a new application. We want the redetermination that was sent to you, completed, signed and dated, and all the necessary verifications that would need to accompany it. And we will take that and we will process that within that 90-day window that you're provided if you miss your cutoff date of June 1st and the drop dead cutoff date of June 15th. So this is why we're asking, please follow the instructions on the form that you received. Samantha led into make sure your address is updated so you do get that you do get those forms timely. And if in fact, when you submit your form through the reinstatement period, for example, that 90-day window, you will not get a new, I believe it says number, a new what's called a recipient identification number. That's your insurance ID. You will not get a new one. You will get the same one. And even if you miss that reinstatement period and you have to reapply, you will not get a new RIN. And Tim and Terry are both on the call from DHS, and we have caseworkers as well that we're trained to make sure that we identify where that case was last touched and reactivating that information.
Thank you for that, Sergio.
I think there was also a question in regards to when the recording would be ready. I'm assuming that it is a question in regards to this recording. As soon as it downloads to my computer, we will send it out ASAP. So thank you for that question.
Yes, and it will appear on our Facebook page most prominently. The next question is, how connected are CHWs to assisting with this effort to help potential clients? Sergio replied, many CHWs have been included in training that we have had. If you're interested in those training materials, please visit the medicaid.illinois.gov website and click the 3-part webinar series on the left-hand side. And then Samantha also added that you can find more information at the hfs.illinois.gov website under the medical programs tab. The next question, which was just recently answered by Samantha, is, would that certify us to perhaps work with schools and churches in our area? She provided the hfs.illinois.gov website.
That's the application agent website with all that helpful information. That's what I have there. Thank you so much.
Thank you. Moving forward, the next question is where in Franklin County?
I'm sorry, James. James, could I just chime in really quick on that last piece there, on that last one? Apologies, but I want to make sure that we're also thinking about a lot of the work that the managed care plans are doing and how customers can easily be connected to them as well through their different phone systems that they have. So if a customer is enrolled in the Medicaid program and they enroll into a managed care plan, they should have received an insurance card, right, Sam? And that insurance card has a lot of relevant information how they can connect with their managed care plan that can provide them with their renewal date and walk them through processes of how to create a Manage My Case account, where they can go to get further assistance, because a lot of the information we have, we're sharing with Samantha and IMHIP, and they're getting it down to the managed care plans who, quite frankly, in certain instances have really great connectivity with the Medicaid customers because they're working with them through coordinated care efforts and through making sure that those individuals are continuing to access the necessary healthcare services. So I really want to leverage that as well, and they govern quite, Samantha, correct me if I'm wrong, but a large population of the Medicaid population.
Yes, we have 80% of the members. And so those numbers, they are on the cards that members receive. The phone number for your health plan is on your insurance card. It has your customer service line. But if you've misplaced your card, or perhaps you're a provider helping Medicaid members and you don't have their card in front of you, the toolkit where I have those customer service lines, those phone numbers are the ones you're going to call to connect with the plan, get that READY date. If you need a care coordinator, you can ask for care coordination. That's all there, along with the FAQs, the frequently asked questions the plans have provided. But really, we are here to assist our members, to assist community-based organizations, and to assist our provider partners.
Thank you for that explanation. Excuse me. The next three questions, I believe, pertain to SNAP eligibility. First question being, where is Franklin County? It is in Southern Illinois. Terry answered that. The next question is, where in Franklin County are restaurants where you can use EBT for a free meal? Terry answered that Bonnie's in Mount Vernon and Joe's in Benton. And then the next question is Mount Vernon in Jefferson County? Terry answered, sorry, Bonnie's is located in several cities, but the West Frankfort location is participating. The next question is, what is the evaluation process? Is there a point system? How is this done? Lori answered this, stating, yes, it is a review of the application and required documents submitted by the grantee. Each program establishes the criteria that will be evaluated and scored. So there isn't one evaluation form, it varies by program. However, the notice of funding opportunity must communicate the evaluation criteria so that the grantees can ensure they are providing the appropriate information. So that was a GATA question. The next question was also just recently answered. That was, who are the MCOs partnering with the complete redetermination? I believe Samantha took care of that one. And then the final question, well, sorry, not the final question. The next question is, how are SNAP benefits still available for college students? Terry answered, the additional exemptions are allowed through June, effective in July. For new applications, the additional exemptions are no longer available. Active SNAP cases will be reviewed at their next redetermination. And then she stated, expected family contribution, $0 for the current school year. The student must be eligible in a state or federal work study program during the regular school year, not necessarily participating in the work study, but eligible for it, was the answer for that question. And then we have three new.
And I think I could answer those, James, quickly if it would be helpful.
Sure. You want me to read them off? Sure.
I could read them.
I'll answer the one directed to the ILBCF, and I'd like James to continue to read the questions. And then if you want to answer, that'd be great, Samantha.
Sounds like a plan. Okay, so the first question, are oral health care benefits included? Providers are slim to almost none, and the wait time for appointments is very long.
Yes, so dentists are included within the Medicaid program. And we as I think both at the MCOs and of course at HFS recognize that dental care is both incredibly important and has been complex within the Medicaid program. And over the course of the last few years, we've done rate increases and partnerships and are continuing to work on improving access to dentists. If you are a Medicaid managed care member and you're having trouble getting an appointment for a dentist, go ahead and call that customer service line for your health plan, and your health plan will work with their network to get you in, and they have some creative ways to do that. So go ahead and reach out to your health plan for if you are enrolled in a Medicaid MCO and you're facing those challenges, but we are working through that.
Yeah, and if you are not enrolled in a managed care plan, as what Samantha was mentioning, we have what's called a health benefits hotline at HFS that you can call. I will drop that number now in the chat. And the health benefits hotline is one that you can access a call center rep, and they can walk you through different options that you will have as a Medicaid customer in terms of accessing that specific type of care. And like Samantha said, we're always thinking about how do we amplify services that are very critically needed in some of our most vulnerable communities. And, so again, top of mind, and we're setting up systems so that, again, people can easily access that information.
Okay, thank you for that. And then the final outstanding question is, what are the limits for MCOs?
And I'll answer that. And I'm assuming that this is around redetermination. However, if there's a broader discussion on MCOs, it sounds like Tiffany is going to set that up. And so we can dive into that later. But right now, what our limitations are is we can answer for those general questions. When's your redetermination date? How do you set up Manage My Case? However, we can't really go beyond that. We also can text and call, send postcards, emails, all of that. So outreach, but HFS and DHS really are the organizations that are handling those redetermination, that process. And we're here as a partner to connect you as a Medicaid member to those organizations. And so that's what we are able to do. If you have a paper copy of an application, we can also connect you to application assisters, and we can answer basic questions, but we're not allowed to enroll as an application agent. And so we can just do basic questions for paper, but we can help you set up Manage My Case online.
Thank you for that. So those are all the questions, the corresponding answers.
So thank you so much. Thank you so much, James. So if there are specific MCOs, or do you want us to broadly just capture all the MCOs for this conversation, please shoot us an email at info@ilbcf.org so that we can make sure that we've captured everybody that wants to be on this call. And of course, we'll work with our partners to do so. Thank you so very much. And now we'll kick it back over. Joint Chairwoman Ammons. Yes, I see you.
Yes, I was listening. I learned so much. Oh my goodness. Thank you all so much for taking the time this evening to break down the redetermination, the Medicaid application, to show people how to complete them. Really will be useful. And as Tiffany downloads the video and make the video available to all of us, we will also help to make the video available to our community so that they can watch it. If there are other questions, they can get them answered through that video presentation. So thank you all so much for taking the evening and being with us. I want to acknowledge that my chairwoman of the Human Services Committee, for which all of you know because you guys go before her committee, Chairwoman Lily is here, and I hope she would say something before we close. Chair, are you there?
Yes, I am. Can you hear me?
Yes, ma'am, we can hear you.
Oh, well, I too want to say thank you to the foundation, the Illinois Legislative Black Caucus Foundation, and your leadership, Representative Chairman Ammons, for pulling this together, bringing our partners at the state level that have many, many services and resources that are available to a vulnerable population, the redetermination, the SNAP, and then those individuals who have vision to help this population through the GATA certification has brought the full circle how we can work together to make citizens of Illinois feel as if that we care and that they have resources available to them. As the chair of the Approach Human Services, as we prepare our budget this year, this information prayerfully will get in the hands of many, and we were able to make new partners to address the population. I look forward to reviewing the video again because I love to direct people to the website, the Illinois Legislative Foundation website, to review this. But I'm also very interested in working with some of the community health workers that are out there and to see if they can be in my district office providing this much needed signing up or answering questions I think that is really an opportunity. So thank you, everyone. Sam, I'm driving home, y'all. But everyone, for just having the time and the information that's going to really help those in need. Again, have a great weekend as well.
Thank you, Madam Chair. I am so excited that we also, Senator Johnson was on. I don't know if Senator Johnson is still on. I think we lost her, but she was here for the majority of this meeting, which was very, very appreciated, so that we can help pass that out. And lastly, I want to turn it over to the chair of the Illinois Legislative Black Caucus Foundation Board for him to give us some closing words before our executive director closes out. Paul? I don't know if
He is here.
I know,
I see his thing. But in the essence of time, if Chairman Williams isn't going to say anything, I will move us along. But of course, he is welcome to interrupt me at any time and say whatever he needs to say to close us out. But wonderful job, everyone. This information was so critically important. I thank once again Joint Chairwoman Ammons for giving the foundation the opportunity to pull this together and really produce this this wonderful informative town hall that we could share with the communities from now until whenever we decide to stop. I thank my Director of Policy, James, for ensuring that so many great partners were on this call this evening. Of course, Representative Lilly, thank you, Senator Johnson in her absence, and most importantly, my government of acronyms. I have to thank once again HFS. I'm going to get this right this time. DFS. I think I got that right this time. No, DHS. I want to give them an F. I'm so sorry. DHS. IAMHP. Did I get that right? Yes. And then the Office of Budget and Management, or Management and Budget. I just probably lost my mind right there. But thank you so much for the information on GATA. I will say that my text messages have been actually ringing off the hook with people who could not make it, who want the information and wants to know how they make it. And to your question, former Rep Wallace, yes, I will let you know what help I need. I really appreciate you reaching out to me for that. Thank you, everybody. This has been such a great evening. And as we said, as soon as it downloads, we will send it out to you. And also, don't let this be the only time you decide to ask questions. If in fact you have questions, make sure that you can plug into those websites and those addresses that the partners gave. But if you find it impossible to find those at this moment, please make sure you send your questions to info@ilbcf.org, and we will make sure that they get to the right partner, because your questions are valuable and making sure that we get this information out is critical. Thank you once again. We are so glad that you joined us this evening.
Thank you all. Have a wonderful night. Thank you, Tiffany.
Bye-bye now.
Bye-bye. Be careful, Lily.